Keir Starmer is to announce NHS Online Hospital to help cut the waiting list. I'm going to read into this more from The Guardian, you guys. So it says that Labour says that services will deliver up to 8.5 million extra NHS appointments within its first 3 years. I think that the NHS app is very good, it's very beneficial, and we should be pushing more towards use of technology. I've spoken about this before in the past, but whether it will make all the difference remains to be seen. Obviously, I think this should be more targeted, obviously, for non-emergency services rather than emergency services, of course, because we still have a lot of people, in particular here in England, where they go to the doctors, they go to the hospital when they generally it's not really as severe as what they can be. Now, that's not implying that people shouldn't go and see a doctor and a GP, but it can depend on what their condition is, certain symptoms that they may have. And doing this through the app can actually be easier, especially as much as the older generation who don't know how to use app or to use computers and technology. We are getting to that point now where pretty much the vast majority of the population has a mobile phone, uses a mobile phone, has apps and whatnot. And the NHS app is supposed to be something that you could be used to help you as well. This shouldn't take away from doctors and nurses being able to still do their general diagnosis on you. That's still really, really important here. But anything, like I said, a technology that can be used to help cut the waiting list in short times is a good thing. I think that that Labour have done so far to an extent, considering how much of a hellhole that the National Healthcare Service was left in under the Conservatives. I think so far that they have done pretty good. Can they be doing more? Absolutely. But I think given the circumstances, it's very, very difficult to do so. I will give Chris West Streeting credit. He has done some good things as health secretary, even though I still have my my issues with him personally, because I just don't think I think he's a scrounger, and I think he's just looking for someone to try and take power for himself. I don't trust the man in any way, shape, or form. However, I will give him and in his government credit where they have done some really positive things when it comes to healthcare, and I'm all for them obviously using healthcare, using communities and health hubs as opposed to just doctors and hospitals and general practices as well, to help cut down waiting times, anything that can help people get the services that they need. And I think these are good things. But obviously time will tell. Like it says 8.5 extra NHS appointments in its first 3 years. Sounds like a lot. And the other thing is as well is that, do we have the sufficient staff to be able to take that on board as well, is the question we should be asking ourselves. So a new online hospital will deliver millions of appointments to help cut the waiting list. Keir Starmer is set to announce in his leader speech at a Labour conference, so it will already be out by the time you guys see this. So the Prime Minister will set out plans for NHS Online, which will connect patients to specialist clinicians. The scheme, which will begin operating in 2027, will deliver up to 8.5 million extra NHS appointments in its first 3 years, the government has claimed. So in his speech in Liverpool on Tuesday afternoon, Starmer will say that the new world is coming and that in the decades to come, excuse me, I want people to look back on this moment as the moment we renew the NHS for a new world. The online hospital will be accessible through the NHS app and will allow patients to choose between digital service and at their local hospital. Those who use the service will be able to access and track prescriptions, who have heard for scans and tests to provide clinical advice on managing their conditions. Patients who require a physical test or a procedure to be able to book them on the app at a nearby hospital, surgical hub or community diagnostic centre. West Street, in the Health Secretary, said some NHS organisations trailing online hospital programmes were trajecting patients within 2 days. Describing how the programme may work, he told LBC, when you're trying to book online or see a GP, booking your appointment via the app, you'll identify that you might be eligible for an NHS online hospital and you'll be directed there. This is where the working people are getting tirade within 48 hours, and that is much quicker. Streeton said the programme would not be rolled out until 2027 because we've got to make sure it's tested and we've got to make sure it's safe. Yes. Yeah, we're talking about people's healthcare here, so this is something that's not going to be done overnight. He says some of us, like myself, much prefer to see someone over the screen or over the phone rather than taking time off work. I can possibly avoid it. The scheme builds on ideas already being used in some NHS trusts to reduce wait-in times and allow patients to get treatment or advice quicker. In his speech, Starmer will describe it as a new chapter in the story of our NHS, harnessing the future patients in control. And he will say waiting times cuts for every person in this country. That's national renewal. That's a Britain built for all. Streeting has ruled out adding VAT to private healthcare after reports that the government was considering doing this in the budget. I personally think they should, but That's because I don't want us relying on private healthcare. Asked on Times Radio whether it was a good idea, he replied no, and the government won't be doing it. He added, "I don't know what the genesis of this story was, but that's not something the government is looking to do." Starmer will stress the need for continuous NHS modernisation, insisting Labour's responsibility to make the health service fit for years to come. He said, "I know how hard people work in the NHS. I see it for my family, and I celebrate it at every opportunity. But the responsibility of this party is not just to celebrate the NHS, but to make it better." And he's right. Daniel Eakes, chief executive of NHS providers, said this is a bold, exciting initiative, but the benefits should not come at a cost of destabilising vital services patients that will continue to rely on. Yeah, this is something that is, I would like to also point out, it is a slow transition, our NHS, as we modernise to more and more technology. Unfortunately, with a lot of these things there's a lot of reliance on the private sector to hold up these things, which I don't personally like preferably. I would rather have it more in-house, state-controlled, rather than private. Much, because especially when you have Platinier lurking over the NHS at every opportunity as well. That is something that deeply concerns me indeed. I don't like that in any way, shape, or form. But I am all for the use of enhanced technology. Anything that would help people get appointments, be able to get treatment that they need, get seen quicker, especially those who have more severe problems than others. If the NHS can help do that and cut online waiting lists, this is all a good thing. It will be very interesting to see how this Christmas winter season goes for the National Healthcare Service, in particular here in England, compared to last year, because this has been the first time. It's been a full year now since Labour. It's been more than a year and a half since Labour have been in power. So we're going to see just how the National Health Service copes over the winter period as well. But what do you guys think about NHS Online Hospital to help cut waiting lists? Perhaps probably be using the use of artificial AI as well to probably help diagnose people to some extent as well. But this is something that's going to be over a couple of years. It's not going to be something that's going to be done overnight. But generally, let me know what you guys think about all of this down in the comment section below. Now, if you found this video interesting and informative, please hit that like button, share it across social media, subscribe if you haven't already. Do check out Rumble and Patreon for exclusive content. And if you want to financially support me in the work that I do here, you can become a YouTube member for as little as 99p. The join button is just below. So thank you all so much for watching, and I hope to catch you all very, very soon.